Most people believe that if a medication is available over the counter, it must be safe. But that assumption is quietly damaging millions of kidneys every single year, especially after the age of 60. My name is Dr. Zeno Phantom, and I've been practicing medicine for over 15 years. Let me tell you about one of my patients, Ahmed, a 67-year-old retired school principal. He came to me with fatigue, mild swelling in his ankles, and rising blood pressure. Nothing dramatic. His lab work, however, told a different story. His kidney filtration rate, what we call GFR, had dropped to 48. That's stage 3 kidney disease. Here's the surprising part. Ahmed wasn't diabetic. He wasn't severely overweight. He wasn't doing anything obviously wrong. But when we looked deeper, we found the real issue, a daily combination of common pills, painkillers, acid reducers, and sleep aids that he had been taking for years. Within 6 months of removing and replacing just a few of those medications, his GFR improved to 58. His swelling reduced. His energy came back. That's the power of understanding root cause. Today I'm going to show you exactly 5 pills that can silently damage your kidneys after age 60, and more importantly, 3 simple science-backed solutions to protect and even support kidney function naturally. Now here's why this matters. According to the Centers for Disease Control and Prevention, nearly 1 in 3 adults over 65 has some level of kidney disease, and most don't even know it. That's because kidney damage is silent, no pain, no warning, until it's advanced. Most people miss this because they focus on symptoms, blood pressure, swelling, fatigue, but ignore the underlying metabolic stress on the kidneys. Here's what's really going on inside your body. After 60, your kidneys become more sensitive to inflammation, blood sugar spikes, and dehydration. Certain medications amplify these stresses, reducing blood flow to the kidneys and impairing filtration. So in this video, we're going to break this down step by step, like a whiteboard session. You'll learn which common pills increase kidney stress, why they become more dangerous with age, and the exact daily habits that protect your kidneys naturally. If you care about your energy, your independence, and your longevity, stay with me, because most people don't realize the damage until it's too late, and we're going to make sure that's not you. Before we break this down in detail, let's map out what's really happening inside your body in a simple, structured way, like a clinical whiteboard session. Because kidney damage after 60 is rarely about one single cause. It's usually a slow accumulation of pressure from medications, inflammation, dehydration, and reduced blood flow. Here are the 6 science-backed insights we're going to uncover. Why common painkillers silently reduce kidney blood flow over time. How acid reflux medications interfere with mineral absorption and kidney filtration. The hidden dehydration effect of certain blood pressure and diuretic drugs. Why sleep medications can indirectly increase toxin buildup in the kidneys. How normal lab results can still hide early kidney stress for years. The 3 simple reversal strategies that can support kidney function naturally after 60. Now here's the key idea tying everything together. Your kidneys are not just filters. They are highly active metabolic organs that depend on 3 things: stable blood flow, balanced hydration, low inflammatory load. When any of these are disrupted, especially by long-term medication use, the kidneys start working under stress. And here's the danger most people don't realize. Kidney decline is often slow, silent, and cumulative. You don't feel it happening until significant function is already lost. That's why understanding cause and effect matters more than chasing symptoms. Let me explain this with a simple analogy. Think of your kidneys like a water treatment plant. If you slowly reduce incoming water pressure, overload it with chemicals, and reduce maintenance, the system still runs, but efficiency drops quietly in the background. That's exactly what certain medications do over years. Now, in the next sections, we'll go into each of these silent stressors one by one, starting with the most commonly used pills in the world, and the one most doctors warn about only after damage begins. If this is making sense so far, stay with me, because the next section is where things become very eye-opening about everyday painkillers. Sign 1. The painkiller trap. Most people don't question, and this is the one I see most often in kidney damage after 60. Almost every patient I've seen with early kidney decline tells me the same thing. Doctor, it's just a simple painkiller. I only take it when needed. It can't hurt my kidneys. This belief is extremely common with NSAIDs, medications like ibuprofen, diclofenac, and similar anti-inflammatory tablets. People assume if it reduces pain, it must be harmless, but the kidneys don't see it that way. Here's what's actually happening inside your body. NSAIDs reduce a hormone-like substance called prostaglandins. These prostaglandins are responsible for keeping blood vessels in your kidneys open and well perfused. When you block them, kidney blood flow quietly drops. So even though your pain improves, your kidneys are now operating on reduced fuel supply. Over time, this repeated reduction in blood flow can stress filtration units called nephrons, especially in older adults where kidney reserve is already lower. Let me explain this with a simple analogy. Imagine your kidneys are like a city water filtration plant. NSAIDs are like partially closing the main water valve feeding the plant. The system still runs. The lights are still on. The city looks normal. But behind the scenes, pressure is dropping, filters are straining, and maintenance cycles are failing slowly. According to the National Kidney Foundation, long-term or frequent NSAID use is a well-documented risk factor for acute kidney injury, especially in older adults and those with existing health conditions. Research published in the Journal of the American Society of Nephrology shows NSAID-related kidney stress is one of the leading preventable causes of medication-related kidney decline in older populations. My recommendation for every patient over 60, instead of reaching for NSAIDs immediately: use a 10-15-minute warm compress for pain, walk gently for 15-20 minutes to increase circulation, and hydrate with electrolytes before considering medication. This simple shift reduces unnecessary kidney stress dramatically. If you're using painkillers more than twice a week, your kidneys are already under pressure. Not next month. Today. If this is helpful so far, consider subscribing. I post content like this every day to help you protect your metabolism, kidneys, and long-term energy naturally. Sign 2. The harmless acid reflux pill. That isn't harmless, and almost nobody connects this to kidney decline. Almost every patient over 60 tells me, "Doctor, I've been taking omeprazole or similar acid medicine for years. It just protects my stomach. It's completely safe." And yes, it does reduce acid, but the assumption that long-term use is harmless is where the problem begins. Here's what's actually happening inside your body. Medications like proton pump inhibitors, PPIs, reduce stomach acid dramatically. That sounds helpful, but stomach acid is not just for digestion. It's also essential for mineral absorption, magnesium, calcium, B12, gut barrier protection, and indirectly, kidney electrolyte balance. When acid is suppressed for long periods, magnesium levels slowly drop, and magnesium is critical for kidney vascular stability and filtration efficiency. Low magnesium, increased kidney stress, reduced cellular energy in kidney tissue. Over time, this creates a quiet but progressive strain on renal function. Think of your digestive system like a security checkpoint at an airport. Stomach acid is the security scanner. It checks what enters your system. When you turn that scanner off completely, more unprocessed materials pass through, and your body has to compensate elsewhere, including the kidneys. So the kidneys end up doing extra cleanup work they were never designed for. A large observational study published in the JAMA Internal Medicine found that long-term PPI use was associated with a significantly increased risk of chronic kidney disease compared to non-users. The U.S. Food and Drug Administration has also issued safety communications highlighting potential kidney-related adverse effects with prolonged use of these medications. My recommendation for patients over 60: before relying on acid-suppressing medication daily, stop eating 2 to 3 hours before sleep. Reduce late-night heavy meals, add ginger or fennel tea after dinner, and elevate the head slightly during sleep. In many cases, these changes reduce reflux symptoms naturally within 1 to 2 weeks. If you've been on acid reflux medication for more than 6 months continuously, your kidney stress profile may already be changing silently, not next week, tomorrow. Sign 3. The water pills that can quietly dehydrate your kidneys. And this is where many older adults are misled. Almost every patient on blood pressure treatment tells me, "Doctor, I take my diuretic to remove extra water. That must be good for my kidneys." On the surface, that sounds logical. Less fluid, less pressure. But the kidneys don't respond well to long-term subtle dehydration. Here's what's actually happening inside your body. Diuretics, often called water pills, work by forcing your kidneys to excrete more sodium and water. In the short term, this helps lower blood pressure. But over time, especially after age 60, it can lead to a chronic low fluid state at the kidney level. And when kidney cells don't get enough stable blood flow and hydration, two things happen. Filtration becomes less efficient. Electrolyte balance becomes unstable. This forces the kidneys to work harder just to maintain basic internal balance. So instead of resting the kidneys, you are actually putting them under constant correction stress. Think of your kidneys like a high-precision coffee machine. They need a steady flow of water at consistent pressure to function properly. Now imagine someone keeps turning the water pressure up and down all day. The machine still works, but internal components wear out faster and consistency breaks down. That's exactly what chronic diuretic use can do when hydration is not carefully managed. Research published in the Clinical Journal of the American Society of Nephrology has shown that electrolyte imbalance and dehydration from diuretic therapy are significant contributors to acute kidney stress episodes in older adults. The National Institute on Aging also notes that older adults are at higher risk of dehydration-related kidney dysfunction due to reduced thirst perception and medication use. My recommendation for every patient over 60 on diuretics: drink water consistently, not in large bursts. Add a small pinch of electrolytes or mineral salt, if medically appropriate. Monitor urine color. Light yellow is ideal. And never take diuretics on an empty, dehydrated body. Consistency matters more than quantity. If your energy feels low, your mouth is often dry, or you feel lightheaded, your kidneys may already be under hydration stress. Not next month. Today. Sign 4. The sleep medications that quietly slow kidney detox at night. And this one surprises almost everyone. Many patients over 60 say, "Doctor, I take a sleeping pill so my body can rest. That should actually help my kidneys recover, right?" It sounds reasonable. Sleep equals recovery. But not all sleep is biologically restorative sleep. Here's what's actually happening inside your body. Your kidneys don't just filter during the day. They are active 24/7, especially at night when the body shifts into repair mode. Certain sleep medications, especially sedative hypnotics and some antihistamine-based sleep aids, don't create natural sleep cycles. Instead, they chemically sedate the brain. This can reduce deep restorative sleep stages, slow-wave sleep, which are essential for hormonal repair, blood pressure regulation, and kidney perfusion balance. At the same time, these medications can reduce nighttime breathing efficiency in some people, lowering oxygen delivery. And kidneys are extremely oxygen-sensitive organs. Less oxygen overnight. Reduced cellular repair efficiency in kidney tissue. Think of your body like a nighttime cleaning crew in a large building. Deep sleep is when all the cleaners work efficiently, removing waste, repairing systems, resetting everything. Sleep medications are like turning off the lights and locking some doors while the cleaners are still inside. They are present, but their workflow becomes slower and less coordinated. So waste removal still happens, just not optimally. A population study published in the British Medical Journal found an association between long-term sedative use and higher risk of chronic health complications in older adults, including metabolic and organ function decline. The World Health Organization has also highlighted that sleep quality, not just sleep duration, is critical for healthy aging and organ recovery, especially in older populations. My recommendation for patients over 60 struggling with sleep. Keep a fixed sleep schedule, same bedtime daily. Stop screens at least 45 minutes before sleep. Use magnesium-rich foods like pumpkin seeds or leafy greens in the evening. And try a 10-minute slow walk after dinner to naturally regulate melatonin. These steps often improve sleep quality without medication dependence. If you need a sleep pill most nights just to function, your body is not truly recovering overnight. Not next week. Tomorrow. Sign 5. Normal kidney tests that hide early damage for years. And this is the most dangerous misunderstanding in nephrology. Almost every patient says, "My creatinine is normal, so my kidneys are fine." This is one of the most misleading assumptions in older adults. Because kidney disease can progress significantly before standard lab markers look abnormal. Here's what's actually happening inside your body. The most commonly checked kidney marker, creatinine, does not rise until a significant portion of kidney function is already lost. Why? Because the body compensates. When early kidney damage begins, the remaining healthy nephrons, filtering units, work harder to maintain normal lab values. So blood tests can appear normal, while internal strain is already present. By the time creatinine increases, you may have already lost a substantial amount of kidney reserve. That's why clinicians also look at eGFR, estimated filtration rate, urine protein, and trends over time, not just a single snapshot. Think of your kidneys like a factory with 100 machines. If 20 machines break, the remaining 80 work harder and production still looks normal. Even if 40 machines are gone, output may still look acceptable for a while. But inside the factory, everything is overworked, unstable, and slowly collapsing. That's what normal labs can look like in early kidney disease. According to the National Kidney Foundation, nearly 90% of people with early-stage chronic kidney disease are unaware they have it. The Centers for Disease Control and Prevention also reports that millions of adults in the U.S. have reduced kidney function without being diagnosed because early stages are typically asymptomatic and underdetected by routine screening. My recommendation for patients over 60: don't rely on a single creatinine reading. Track trends over time. Request eGFR alongside routine labs. Check urine for protein at least once yearly. And monitor blood pressure at home consistently. Early detection is not about one test, it's about patterns. If you are told your labs are normal, but you still feel fatigue, swelling, or reduced stamina, don't ignore it. Not next month. Today. The 3 simple solutions to protect your kidneys after 60. This is where we shift from damage control to real protection. Solution 1. Restore kidney blood flow daily. Here's what's really going on inside your body. Most kidney stress after 60 is not from sudden failure. It's from reduced, inconsistent blood flow over time. Whether it's painkillers, dehydration, or age-related vascular stiffness, the result is the same: less oxygen and less filtration efficiency. So the goal is simple: improve circulation without stressing the body. A powerful, evidence-aligned habit is low-intensity walking. Even 20-30 minutes of walking increases nitric oxide production, which helps dilate blood vessels, including those in the kidneys. Think of it like reopening narrow irrigation channels so water flows smoothly again. My recommendation: 20-30 minutes of brisk walking daily. Light movement after meals. Avoid long sitting periods. 90 minutes. Small movement. Better kidney perfusion. Solution 2. Stabilize hydration, not just water intake. Here's what most people get wrong. They think drinking more water automatically fixes kidney health. But kidneys don't respond to volume alone. They respond to balance. Electrolytes like sodium, potassium, and magnesium are what allow water to actually enter cells and support filtration pressure. Without them, water just passes through without proper cellular hydration. Let me explain this simply. Water is the delivery truck. Electrolytes are the roads. No roads. Trucks don't deliver properly. My recommendation: drink water consistently throughout the day. Include natural electrolytes, lemon, pinch of mineral salt if appropriate. Eat potassium-rich foods like spinach, cucumber, and bananas. Avoid chugging large amounts at once. Steady hydration protects filtration pressure. Solution 3. Lower inflammation load on the kidneys. Here's the deeper layer most people miss. Kidneys are extremely sensitive to inflammation driven by blood sugar spikes, processed foods, chronic medication use, poor sleep. Inflammation makes filtration tissue stiff and less efficient over time. The goal is not extreme dieting. It's lowering daily metabolic stress. Simple protocol. Reduce ultra-processed foods. Add omega-3 sources, fish, flaxseed, walnuts. Keep blood sugar stable, protein plus fiber with meals. Avoid late-night heavy meals. This reduces internal chemical workload on the kidneys. If you only remember one thing from this video, remember this. Kidney health after 60 is not about treatment. It's about reducing silent daily stress. Not next week, tomorrow. Let's bring everything together clearly. Your kidneys are not fragile, but they are highly sensitive to long-term stress. We covered 5 common medication categories that can quietly affect kidney function after 60. Painkillers that reduce blood flow. Acid reflux medications that disrupt mineral balance. Diuretics that can create chronic dehydration stress. Sleep medications that reduce nighttime repair quality. And the hidden danger of normal lab results masking early decline. But more importantly, you now understand the real physiology behind kidney aging. It's not sudden failure, it's slow overload. And the encouraging part is this. Small, consistent changes can significantly reduce that load. The 3 core solutions we discussed are simple but powerful. Daily movement to restore circulation, balanced hydration with electrolytes, and lowering inflammation through food and lifestyle. These are not extreme interventions. They are foundational biology corrections. Here's the deeper truth. Your kidneys respond more to daily habits than to occasional medical interventions. Every glass of water, every walk, every meal either supports or stresses them. So here is your challenge. Try just one change from today. A 20-minute walk, better hydration timing, or reducing one inflammatory food or habit. And observe what changes in your energy over the next 7 days. Because the goal is not perfection, it's direction. If this added value to your understanding, like the video and subscribe. I share simple science-based strategies to help you protect your metabolism, energy, and long-term health naturally. Stay consistent. Your body responds to consistency more than intensity.